Let me ask you something. Have you ever looked at that little orange box of baking soda in your kitchen and thought, could this possibly save a life? I know it sounds dramatic, but after 20 years as a doctor, I've learned never to underestimate the simplest things. Every day, patients come to me seeking expensive solutions, fancy supplements, or miracle cures. But sometimes, what they need is already sitting quietly on a shelf, waiting to be discovered. In this video, I'm going to show you why baking soda might just be the most overlooked natural remedy in modern medicine. Backed by science, supported by stories, and grounded in compassion, this humble powder may change how you think about health forever. Welcome to the healthy path. Let's start with one of the most misunderstood words in wellness today, detox. It's become a buzzword, often misused, but let me share with you what the science really says. Your liver, kidneys, lungs, and skin, they're your built-in detox team. But for those living with high acid levels due to poor diet, chronic stress, or medical conditions like kidney disease, that team needs some support. Here's where baking soda enters the story. When you dissolve it in water, it forms an alkaline solution that can help buffer excess acids, internally and externally. Some of my patients with sensitive skin find comfort in baking soda baths. Not as a magic cure, but as a gentle way to ease rashes, reduce inflammation, and restore balance. In fact, a study published in the Journal of the American Society of Nephrology revealed that sodium bicarbonate supplementation slowed the progression of chronic kidney disease by reducing metabolic acidosis. Think about that. A kitchen staple, impacting long-term kidney health. But let me be clear, it's not for everyone. Self-dosing is risky. Always talk to your doctor. Baking soda may be natural, but it is still biochemistry in action. Used wisely, it can support your body's detox pathways, especially when guided by someone who understands your unique needs. Let's talk about your smile, because it's more than just cosmetic. Your oral health is directly connected to your overall well-being. For over 2 decades, I've witnessed how something as simple as a change in toothpaste can reduce inflammation, reverse gum issues, and improve confidence. Baking soda or sodium bicarbonate is mildly abrasive, just enough to lift stains without damaging enamel when used properly. More importantly, it helps neutralize acids in the mouth, making it less hospitable to the bacteria that cause cavities and bad breath. One study in the Journal of Clinical Dentistry found that toothpaste containing baking soda was significantly more effective at removing plaque and whitening teeth than conventional alternatives. But please don't scrub your teeth raw with it. Once or twice a week, gently applied with a soft toothbrush is plenty. And always avoid applying it to inflamed gums or exposed roots without guidance. You don't need harsh chemicals or expensive whitening kits. You need knowledge, consistency, and respect for the biology of your mouth. Heartburn is one of the most common digestive complaints I hear about in my practice. That burning sensation after a rich meal, it's more than just uncomfortable. It's a warning sign. When acid escapes the stomach and rises into the esophagus, it causes what we call gastroesophageal reflux. Left unchecked, it can damage tissue and erode quality of life. A traditional home remedy, baking soda in water, has stood the test of time. And it's not just folklore. Sodium bicarbonate is a recognized antacid in clinical pharmacology. By neutralizing excess stomach acid, it offers rapid relief. 1 teaspoon in a glass of water, sipped slowly, can calm a flare-up within minutes. However, it's not a long-term solution. If you're reaching for this remedy more than once a week, you need to consult a doctor. Frequent reflux might be a sign of something deeper. If you've ever battled athlete's foot or ringworm, you know how persistent fungal infections can be. The itch, the discomfort, the frustration, it can disrupt your daily life. Fungi thrive in warm, damp, acidic environments. What baking soda does is disrupt that environment. It raises the pH, weakening the fungal cell walls. In a study published in Mycopathologia, baking soda inhibited the growth of over 80% of fungal strains tested. That's not speculation, that's science. For mild skin infections, I often recommend patients try a foot soak, 1 tablespoon in a basin of warm water for 15 to 20 minutes. You can also make a paste and apply it directly. Of course, if symptoms persist or worsen, you need medical attention. But for early-stage, non-severe cases, this simple remedy can be a game changer. There's nothing quite like the discomfort of a urinary tract infection. The burning, the urgency, the pain. It can be debilitating, and it's more common than you think. As a physician, I always recommend prompt antibiotic treatment for UTIs. But alongside that, there are natural remedies that can offer support, and baking soda is one of them. The logic is grounded in biochemistry. UTIs thrive in acidic environments. Sodium bicarbonate can help shift the pH of urine slightly toward alkaline, making conditions less favorable for bacterial growth. In a Japanese study published in the Journal of Urology, 33 women with recurrent UTIs took a small amount of sodium bicarbonate each day. After 4 weeks, most reported reduced pain and less frequent symptoms. Now let me be clear, this is not a cure, and it must never replace medical treatment. But for those struggling with persistent discomfort, a physician-guided approach using baking soda can provide much-needed relief. Try mixing 1/4 to 1/2 teaspoon in a glass of water once daily for up to 3 days, no more, unless your doctor advises otherwise. Have you ever had one of those painful little ulcers in your mouth that make talking, eating, and even smiling feel impossible? Those are called canker sores, or aphthous ulcers, and they're more common than you think. Stress, minor injuries, nutritional deficiencies, all can trigger them. But one thing that can speed up healing? Balancing the pH in your mouth. That's where baking soda plays a gentle yet powerful role. A warm rinse made with 1/2 teaspoon of baking soda in a glass of water can soothe inflammation and create an alkaline environment less friendly to harmful bacteria. In a study published in the Journal of the American Dental Association, participants who used baking soda rinses saw significant pain relief and faster healing in just a few days. It's simple, affordable, and incredibly effective when used consistently, usually 2-3 times a day after meals. And because it's non-toxic, it's safe for most people, even kids over 6. If your ulcers are persistent, recurrent, or unusually large, see a doctor. But for that occasional flare-up, this remedy may be your best-kept secret. Here's something that surprises many of my patients. Baking soda isn't just for your kitchen or medicine cabinet. Athletes have been using it for decades to boost performance. During intense exercise, your muscles produce lactic acid. That burning feeling? It's a drop in pH, your muscles becoming too acidic to function efficiently. Sodium bicarbonate acts as a buffer. Taken before exercise, it helps maintain a more neutral muscle environment, delaying fatigue and helping you push harder, longer. A comprehensive meta-analysis published in the Journal of Strength and Conditioning Research showed that sodium bicarbonate improved performance in high-intensity, short-duration activities like sprints, cycling, and swimming. Athletes often take a dose, around 0.3 grams per kilos of body weight, 60 to 90 minutes before a workout. But I always recommend starting small, 1/2 pool TSP in water, test your tolerance, and never try it for the first time on competition day. And yes, there can be side effects, bloating, gas, or nausea, so moderation is key. But if used wisely, this overlooked ingredient may give you an unexpected edge. Now, let me take you inside the body, into the kidneys, those 2 silent workhorses that filter over 50 gallons of blood every day. When they weaken, acid builds up. It's called metabolic acidosis, and it accelerates kidney damage. Over the years, I've treated hundreds of patients with early-stage chronic kidney disease, CKD, who struggled with this hidden threat. But what if I told you that something as simple as baking soda could help ease that burden? In a landmark study published in the Journal of the American Society of Nephrology, patients with advanced CKD were given daily doses of sodium bicarbonate. The result? Their kidney function declined more slowly. Some even avoided dialysis. Why? Because by reducing acidity in the blood, baking soda helps lighten the kidney's load. It's not a cure, but it can delay disease progression under proper guidance. In my own practice, I've seen cautious bicarbonate therapy improve bicarbonate levels, reduce fatigue, and even improve appetite in CKD patients. But please, hear me loud and clear. Never start this on your own. The dose must be precise, and side effects like fluid retention and high blood pressure are real. If you have kidney issues, speak with a nephrologist before using baking soda. In the right hands, it can be a powerful tool. If you've ever lived with arthritis, you know it's more than just pain. It's fatigue, frustration, and a constant search for relief. Rheumatoid arthritis, in particular, is a storm of inflammation. Your immune system turns against you. But what if you could gently nudge it back to balance? A 2018 study in the Journal of Immunology found that baking soda, when consumed regularly in small doses, helped reduce systemic inflammation by shifting the activity of immune cells. It calmed the overactive responses, enhanced anti-inflammatory ones, and created a more healing internal environment in both animal and human subjects. For patients with gout, a painful form of arthritis caused by uric acid crystals, baking soda can help too. By raising blood pH, it may reduce uric acid buildup and lessen the intensity of attacks. One clinical review in arthritis and rheumatism showed that alkalinizing the urine helps excrete uric acid faster. That's what baking soda does. My guidance? Mix 1/4 to 1/2 TSP in water and take only a few days per week under medical guidance. Especially for older patients with heart conditions, caution is essential. Let's pivot to something almost all of us face: colds, flu, respiratory infections. When symptoms hit, the goal is comfort, faster healing, and fewer complications. Baking soda, when used as a gargle, can reduce sore throat pain and even microbial load. It's a time-tested remedy, now backed by modern science. In the Journal of the American Dental Association, baking soda rinses significantly reduced microbial activity in the throat and accelerated recovery. You can also mix it into saline for nasal rinses, breaking down mucus, neutralizing acids, and helping you breathe easier. But beyond infections, researchers are now exploring baking soda in a far more serious context: cancer. Cancer cells often thrive in acidic environments. A groundbreaking 2009 study in cancer research showed that alkalinizing the tumor microenvironment in mice made chemotherapy more effective and slowed cancer spread. Now, we are far from clinical recommendations, but this research opens a door. One day, baking soda may support conventional cancer therapy. But until then, let's remember, it's a support, not a solution. Always follow evidence. Always consult your care team. Tired of deodorants packed with chemicals, parabens, and aluminum? Baking soda may offer a simple alternative. It neutralizes acidic sweat and inhibits odor-causing bacteria, naturally. In a study in the Journal of Cosmetic Dermatology, topical sodium bicarbonate significantly reduced underarm odor compared to controls. To try it, dust a pinch under your arms or mix with coconut oil for a smoother texture. It's safe for most people, but those with sensitive skin should do a patch test first. Now, before we close, a word of caution. Baking soda may be natural, but it is not benign. If you have kidney disease, high blood pressure, ulcers, or heart conditions, consult a physician first. Overuse can lead to alkalosis, high sodium levels, and serious complications. If there's one thing I've learned after 20 years of practice, it's this: small choices matter. That little box of baking soda might not look like much, but in the hands of knowledge and care, it can become a powerful tool. Not every remedy has to be expensive. Not every solution comes in a bottle from the pharmacy. Sometimes what we need is already in our home, and all we need is the right guidance. So now, I'd love to hear from you. Have you ever used baking soda as a remedy? What worked or what didn't? Share your story in the comments below. Let's learn together. And if you found value in this video, don't forget to like, subscribe, and share it with someone who might need a natural path to better health. Thank you for walking with me on the healthy path.